Opioid antagonists, like the name suggests, are medications used mainly to reverse the side effects of opioid agonists and to prevent opioid addicts from relapsing after they've recovered. As a class, opioids share one thing in common. They bind to opioid receptors in the brain, spinal cord, and gastrointestinal tract. Some are endogenous, meaning they are produced naturally by the body, like endorphin, short for endogenous morphine. But others are exogenous, meaning they come from outside the body, like heroin and morphine, which come from the opium poppy, a flowering plant that oozes a milky white liquid. To understand how opioids work, let's zoom into a region of the brain tissue that has opioid receptors. Normally, in the absence of endorphins, inhibitory neurons secrete a neurotransmitter called gamma-aminobutyric acid, or GABA, that prevents nearby neurons from releasing neurotransmitters like dopamine, serotonin, and norepinephrine. Now let's say someone goes to play a rigorous game of badminton. Exercise releases endorphins, which activate the three major opioid receptors located in the inhibitory neurons, called the mu, kappa, and delta receptors. As endorphins bind to these receptors, they block the inhibitory neuron from releasing GABA, allowing the dopamine, serotonin, and norepinephrine secreting neurons to freely unload their neurotransmitters, which then get picked up by another neuron in the same area. Norepinephrine and serotonin release takes place in pain processing regions of the brain, like the thalamus, brainstem, and spinal cord, resulting in a decreased sensitivity to pain. When dopamine release takes place in reward pathway regions, like the ventral tegmental area, nucleus accumbens, and prefrontal cortex, the result is a calming sensation that feels really good. However, there are also opioid receptors throughout our body, like in the gastrointestinal tract. So when a person receives a dose of morphine, it could also result in a series of unwanted side effects, like nausea, vomiting, and constipation. However, the most dangerous side effect is respiratory depression, caused by stimulation of the respiratory centers located in the medulla. This happens when a person overdoses on an opioid like morphine or heroin. Respiratory depression can be life-threatening and should be treated right away because the person can literally stop breathing. Now, in order to treat opioid overdoses, we can use opioid antagonists like naloxone, naltrexone, methylnaltrexone, and dalvimapine. These medications bind strongly to opioid receptors without activating them. Since opioids are binding and unbinding to receptors constantly, once an opioid releases its hold on a receptor, naloxone can simply sneak in and bind more strongly. Naloxone has a rapid onset and a short duration of action of 1 to 2 hours. So when it's given intravenously, it can reverse the side effects of opioids within minutes, potentially saving a person's life. In addition, when women in labor need to take opioid analgesics, the medication can pass through the placenta, causing respiratory depression in the baby. Naloxone can also reverse this effect and save the baby's life. Another use of naloxone is to detect when a person is opioid dependent. A person who is a chronic user of opioids like morphine or heroin can develop tolerance. This happens when the opioid receptors are constantly being stimulated, so the neurons eventually adapt and become less responsive. So now a higher dose of opioids is needed to get these neurons to function normally. If the stimulation stops, like when a dose of naloxone is given, the neurons will become understimulated and we get withdrawal symptoms like anxiety, shivering, tremors, yawning, body aches, diarrhea, abdominal cramps, runny nose, sneezing, sweating, and an increased heart rate and blood pressure. Whew. Now, naltrexone is also an opioid antagonist, but it has a longer duration of action lasting from 8 to 12 hours. This makes it useful in preventing relapse in people who recently recovered from an opioid addiction, because they can no longer get the euphoric feeling even if they try to use opioids again. Now, since alcohol can make people feel good by triggering the release of endogenous opioids like endorphin, naltrexone can be used in recovering alcoholics through the same mechanism. The last group of opioid antagonists include methylnaltrexone and dalvimapine, which can't cross the blood-brain barrier. They are mainly used to treat GI symptoms like constipation that are caused by opioid analgesics. They are particularly useful for treating post-operative ileus, where there's decreased GI motility that's worsened by opiate use. Now, let's make a simple and fun mnemonic that'll help you efficiently memorize these pharmacology facts. Since a lot of these medications have nal in them, let's use a nail salon. The right side of the salon is where we keep the medications that could cross the blood-brain barrier. So let's put a TV showing the brain here. Watching this show, we have a customer who's wearing a giant lock around her neck for naloxone. She's on a respirator to help you remember it's used to treat respiratory depression and the other side effects of opioid overdose. She's rather short to help you remember it's short-acting. Now, waiting for her is a very tall lady in a tracksuit for the long-acting naltrexone. She's trying to adopt a healthy lifestyle after getting over her addictions, as can be seen by an alcohol bottle and a heroin needle in a trash can next to her. This will help you remember that naltrexone is used to help people abstain from future drug use. Okay, so on the left side of the room we have the medications that don't cross the blood-brain barrier. The TV on this side is showing intestines to help you remember that they are used for GI side effects caused by opioid analgesics. Here we have naloxone's twin sister, methylnaloxone, who's wearing a nerdy I Love Math t-shirt. Her husband is an Elvis impersonator for alvilmapan, and he's moping around about having to come to the nail salon. Alright, as a quick recap, opioid antagonists are medications that strongly bind to opioid receptors and prevent their activation. Naloxone is used to treat respiratory depression caused by opioid overdose and to detect when a person is opioid dependent. Naltrexone is used to help recovering opioid or alcohol addicts maintain abstinence. Finally, methylnaltrexone and alvilmapan are used to treat the GI side effects like constipation caused by opioid analgesics. But wait, there's more. Here's a mind map with all the mnemonics from the video. Go ahead and pause the video so you can test yourself to see what you remember. Stay tuned for the answers at the end.